This week in California, a federal judge ruled against 3 nurse practitioners who wanted the right to call themselves doctor. In California, we have a law that prohibits anyone from calling themselves doctor in the medical clinical setting if they are not a physician. So these 3 nurse practitioners were calling themselves Dr. So-and-so with no clarification, and they were doing it on websites, social media, on their jackets, and promotional materials for their businesses, one of which, of course, was a med spa. They ended up suing the state of California after being fined and were trying to fight for their right to call themselves doctors publicly without clarification. And the federal judge decided that no, they indeed do not have the right to do this because it's confusing for patients. I think it's best to look at this as not a turf battle, but a patient safety battle. Patients deserve to know who's caring for them and what their qualifications are. They mention in the judgment that a survey was done of the general public, and 39% of people think a DMP is a physician. They also noted in the judgment that 2 of the nurse practitioners in their deposition said that they chose to call themselves doctor for financial gain because they believed that it made them appear more knowledgeable and would bring more patients in. Our goal as medical practitioners is to do best by our patients, and unfortunately the science literacy is very low in this country, and patients just clearly from the survey they mentioned do not know the education level and the background of different types of medical professionals, and it is our job to help them understand as best as possible. And yes, it matters, because when patients are making very important decisions for their lives, for their health care, for their families, they deserve to know where those recommendations came from and what the qualifications are of those people. I love truth in advertising laws because I think patients deserve to know who's caring for them. They deserve to know your educational background, and they deserve accurate evidence-based information. In the practice of medicine, doctor is both a title as well as a profession, and this is what makes it confusing for patients. It doesn't matter if you think it should be this way. It is indeed this way based off of our surveys of the general public, and so we need to educate our patients so they, again, know who's caring for them.